Well, unfortunately, COVID-19 is once again rocking the world and, of course, the sports world. Joining me now is Dr. Myron Rolle. He, of course, is a former NFL player, and he is currently a neurosurgical resident with Harvard and MGH. He's going to try to explain it to us all in sort of layman's terms. Dr. Rolle, let's just first start with a pretty general question. Why all of a sudden, really within the last, say, week, are we seeing this massive uptick in positive cases across professional sports?
Well, thanks for having me again. I think, honestly, it's multifactorial why you're having such a crisis and such an outbreak in multiple teams. First, you have this Omicron variant that is now all over the country. It's very transmissible, very infectious. You also have the Delta variant that's ravaging through communities and hospitals. My own hospital, Mass General, is at a capacity disaster. So we're actually turning patients away to go seek other emergency departments elsewhere because we have so many people with the Delta variant at our hospital. And then there's also the idea of the holiday season happening. You have players who are opening their doors and allowing family members and friends to come in contact with them who aren't under the same rigid COVID protocols as they are in the NFL locker room. You have players who aren't vaccinated that we know, Aaron Rodgers. We have others who are feigning like they're vaccinated, but not really. And so there's a little bit of confusion which pathway they should be on based on the agreement by the NFLPA and the NFL prior to the season. But I think the most important reason why we're seeing this uptick in cases is the relaxation of protocols that have existed across the league. The mask wearing, the hand hygiene, the social distancing, the infrequency of testing that we've been seeing. If you don't know if a virus is in the building, then it's hard to sort of thwart it. So I think, all of this together causes a lot of concern and really puts the NFL in a challenging situation.
Yeah, so they did release, the NFL did today, enhanced protocols as they head into the Christmas season and the New Year, and of course, the push into the NFL playoffs. Is it too late for that to make a difference? And what do you think of their new parameters?
Well, I think that makes a lot of sense. Honestly, there were a few teams who had, upscaling of cases that went into this enhanced protocol, but now making it uniform throughout the whole league, I think makes sense. It's better to be proactive than reactive on these things, and maybe a little bit reactive in a way, but, without other teams having, major outbreaks, you want to sort of get out in front of those as well, be preventative and work further upstream to make sure that you're keeping these games on. As a former NFL player, also a physician now, I'm a proponent of these athletes having the chance to exercise their abilities because it's a transient window to do it, but you want to make sure they're healthy and safe. And so these advanced enhanced protocols, I think, are important. I think they work. I think they also just to continue to focus and encourage booster shots for those staff members who are in close contact and engage with players all the time, and even the players getting booster shots. I know the NBA has done a few, but it's a lot. It's a multi-pronged approach to try to figure this all out. And I know the NFL is doing their best.
I've seen some questions out there saying, well, the NFL and Dr. Sills yesterday said that most of the cases right now are mild or asymptomatic. So what's the big deal? Why do we have to change everything? Why do guys have to sit out? Why do they, Dr. Rolle?
Well, I think, right now it's a little bit too early to sort of stratify players based on if they've been vaccinated and if it's an Omicron variant and, can we shorten the time that they have to stay away from the team or allow them to participate even if they have the Omicron variant, because we've seen it's mild, asymptomatic, and this particular subset of the population, these fine-tuned athletes, do well. They don't get hospitalizations, they don't have intubations, they don't flip prone, they're not getting these acute care resources from intensive care units. So maybe that research will show us later down the line that this may be the move. But right now, you have to work in an abundance of caution to make sure that everyone's protected and doing all the basic steps, the fundamental basic steps that our public health experts have been telling us to do to ensure, a safe gameplay, as well as when the players leave, that they're protected and their families are as well.
Yeah, speaking of an abundance of caution, yesterday there were some indications that maybe the NFL would be much more lenient with vaccinated asymptomatic players and allowing them to get on the field much quicker. Now it seems under the new rules, they're still going to have to produce some testing, but honestly, it's a little confusing as to how this might get guys on the field a little bit faster. Can you explain the new testing procedures for asymptomatic or mild symptom vaccinated players?
Well, I know the NFL is considering all possibilities, and they've been working with epidemiologists, outside companies, outside public health experts, virologists, and immunologists to work this through. Dr. Alan Sills, who's actually a neurosurgeon from Vanderbilt, incredibly bright person, and is really tried to be out in front of this as best as he possibly could amidst a pandemic when you're playing an elective sport. But right now, as it exists, players who are vaccinated before this sort of enhanced protocol went in, they would get tested once. Then they could pick up the virus on Tuesday or Wednesday and spread it throughout the whole locker room without mask on or anything like that. Sort of any protocol that they really had to go through. It's almost like they were walking through the locker room as if it was pre-pandemic, but now it's a little bit different, where the testing is going to happen more frequently, more rapid. Positive tests are still positive tests. That's the thing to remember. We're not out of this situation where we can ignore positive tests. It's real, because you can infect people through the nose, through the mouth with the contagion and be incredibly virulent and spread it to people who may not be as protected or as healthy as you are. So, I think you'll see more players, more understanding of what's going on as we, make a few weeks into this enhanced protocol. You'll see more cases being picked up. You'll see more players being separated from the team. But if they're all Omicron and the data entry points are telling us that these players are doing well clinically, their statuses are okay, then I can see a shift into bringing these players back sooner than the 10-day separation period, which we've been a part of for the last year or so.
Yeah, and it seems like the new testing procedure is going to allow for that. From the chart, and listen, the chart sort of made my head spin, Dr. Rolle, but from what I understand, it used to be that a player had to test negative 2 days in a row, 24 hours apart. But now they're going to be able to take multiple tests every single day once they test positive. And if they get, I think it's 2 of those negative tests, either the MESA and or the PCR, they will be able to return more quickly. So they're not going to wait as long in between testing for, again, asymptomatic to mildly symptomatic vaccinated players. Am I understanding that correctly?
That's absolutely correct. And, there's even a shift from some public health experts of reducing that number of negative tests produced to only being 1 as we move forward and get more entry points into this. But as I mentioned before, positive tests are positive tests. And I think as a provider, I'm always incredibly conservative. Like I work towards what is the worst that can happen, and then move towards, okay, this person is safe. I look at these infected cases as being patients. And so you have to handle this with care, despite the fact that we've seen players clinically do well with this and not have some of the sequelae that you've seen the general population of U.S. males around the same age have from our peer-reviewed articles and studies that a lot of researchers have done so far.
This pandemic has been extremely disruptive, physically, emotionally, economically, whether you're an NFL player or a regular person. And the most common question I feel right now that's sort of circulating is, what point do we need to get to where we don't have to stay home for 10 to 14 days? If I am vaccinated and I am boosted and I have tested positive and I am asymptomatic and can play hockey or play football, can I just go back on the field and play? Where do we need to get to, Dr. Rolle, where our lives don't stop every single time someone gets infected with COVID-19?
That's a great question. And I think it's a multi-pronged or multi-dimensional answer that has to come with it. I think there's many, researchers, scientists, and epidemiologists around the world that need to, have comparable studies to what is happening for athletes, people of same age, same race, adjust for, socioeconomic backgrounds, adjust for all these different variables until you can say statistically significant. There is, good enough data to say you can get back on this field earlier, or even if you are positive, you can still play and compete, because your chances of, becoming susceptible to this virus and getting hospitalized and having those severe morbidity and mortality sort of complications is very, very low. I don't think we're there yet. I think it takes an incredible amount of heavy lifting, an incredible amount of data entry. And I think we're probably months, even if maybe a year away from that, even though we're growing tired of having to sit out, given these waves, these spikes and these peaks and valleys of COVID infections. I still think that we need to sort of move slowly, go low, go slow, work with the public health experts who are trying to do their best to keep us safe. And then eventually we'll get there. I do believe, I'm optimistic that we will, but we just need to sort of, move with caution as flu season hits us, as another variant may come, as things change in this dynamic state of a pandemic that we're currently in.
And until then, get vaccinated, get boosted. Still the message?
Absolutely. Get vaccinated, get boosted. If you don't think that these things are for you, whether you have an allergy or you just have a philosophical difference, fundamentally, disagreement with that process, well, then protect yourself and do all the lifestyle modifications that you need to do, staying away from large crowds if you think these people may be unvaccinated, when you're indoors, wearing a mask, hand hygiene for sure. And if you have symptoms, be sensitive to them and report to your primary care physician or the local emergency department to take care and mitigate these things. So there's a lot of work to be done, and I'm confident that American citizens can get it done.
Okay, so it's going to be at least a couple months to a year before I can talk to Dr. Rolle about something not COVID related. I look forward to that day, Dr. Rolle, and actually seeing you and meeting you in person, not just over Zoom. Thanks so much for taking time. I know you're really busy.
Thank you very much for having me. I appreciate it.